Valeria, if she's still there. There was a couple of questions about your work, Valeria. One of them was from Elise, and she wanted to know whether you saw a difference between East and West, or East and Western Europe, when you did your survey.
Yes. So we found out that there are several differences between the different countries, and that's why we chose different countries from different European region. And those are different in terms of availability of services, but also in terms of perception of services. We will analyze in depth those differences that will be shown in the report.
Great. And really quickly, Jeanette wanted to know whether you asked about different types of appointments. So she was saying there's a difference between your first appointment as to a follow-up, whatever. Did you analyse out different types of appointments, or was it just sort of appointments in general?
Yeah, so as I said, the questionnaire was quite extensive. So, and we structured that in a way that we had, let's say, three sections for treatment, care, and diagnosis. So for each of those, we have asked for the use, the perception of digital tools and services. So yes, so this includes also the different kind of medical appointment or online consultation.
Great, thanks, Valeria. Elise, you've already answered this online, so maybe I'll just summarise it. But you were asked how your work was being funded, and you said by multiple pharma companies, so that you remain your independence. So I don't know if you want to add any more to that, Elise.
Well, yeah, it's really important for us that not one pharma company is involved, but we bring multiple companies together also because I think they can also learn from each other and as to be involved in one program together. And of course, we also hope to get some buy-in from tech companies that can really help us on a practical level with building the ecosystem. But I must admit that also for us, there are a lot of incertitudes left before we can really proceed with this.
Great, thank you. Lucy, loads of interest in home spirometry. How much do they cost? Or
I just saw this.
You don't have to buy them.
So they can be quite expensive, and I know from speaking with the UK centres that I think the cost might change if you're buying, hundreds to if you're buying one. The costs vary depending on the make. And I know that the UK centres are using Nuvo Air and Spirobank, and there's a third which isn't used as commonly, so I can't quite remember the name. But if you're in a patient organisation and you rely on spirometry, I think definitely having conversations with those companies would be perhaps useful, because I think this is going to be a growing thing in the years to come. But yeah, they can be expensive, and I wouldn't want to endorse any in particular. And I think being careful about alternatives that you can find on places like Amazon is something to be really cautious about, because you want to make sure that the readings are correct.
Brilliant. Thanks, Lucy. And your tip on Apparito, I think we'll all be Googling that organisation.
Yeah, I'll put the link in the chat now.
That would be great. Yeah, excellent. I don't think we had any specific questions for Jedra or Mindy, other than just, great talks. And Mindy, I think it's absolutely fantastic, the psychological support and the alternative digital help that you're giving. So lots of positive comments about that. Keld, I don't know if there's anything I've missed, but 1 minute to past. So if you've got a final question or a final comment you want to make.
So yeah, no, I think you picked up on most of it. So I was thinking about Andreja and Sandra's presentation, also about how difficult is it to get information campaign through in a moment of crisis. If they had any thoughts, how
thank you. That is a very interesting question, because it was very challenging, but we already have a good social network on the platforms, so that was not the problem. And we have, as we have mentioned in our presentation, excellent support from media. That is very important when you have media on your side, journalists, when you have celebrities that join, support your campaigns, then you have very excellent national feedback. And so we are very proud of it. This is not the only one. We have multiple projects before and campaigns, but we want to raise the public awareness about not only lung cancer, but other respiratory diseases. So it's very important for our site to cooperate together. Yes, we are nurses, but in this case, we are representing patients, and we want the best for them. And of course, for that, you need to work also in their interest. And we are happy to say that we have very good feedback. For us, it's not happened just in the last year. Yes, last year was inflation of all the situation, but we already have multiple projects from previous years.
Fantastic. And it's so impressive that people are actually able to absorb the message as well in situations like that. So thank you so much.